OCREVUS ZUNOVO is a 2 times a year injection for adults living with RMS and PPMS. It takes approximately 10 minutes to inject and is administered by a healthcare professional. Let's talk about how OCREVUS ZUNOVO is given and what to expect at your treatment appointment. OCREVUS ZUNOVO is a subcutaneous injection administered under the skin into the abdomen by a healthcare professional. It's a single 920 milligram dose and contains an additional ingredient, an enzyme called hyaluronidase, to help with absorption into the body. Together with your healthcare team, you can decide if OCREVUS ZUNOVO is a good option for you. You may be able to receive OCREVUS ZUNOVO at your doctor's office, at an infusion center, or at home via a home health provider. If an infusion center is the right location for you, your healthcare team can help you find one. The actual administration of OCREVUS ZUNOVO will take approximately 10 minutes every 6 months. Let's take a look at each step of the treatment experience and the approximate time for each step. Before your treatment, tell your doctor about your medical history, such as Hep B, vaccinations, and colitis, to provide access to the injection site, your abdomen. It's a good idea to wear loose-fitting clothing to your appointment. At least 30 minutes before each injection of OCREVUS ZUNOVO, you will take pre-medications orally, an antihistamine and corticosteroid to help reduce injection reactions. You may also receive other medicines to help reduce injection reactions, such as acetaminophen. Your healthcare team will advise you on how to take all pre-treatment medications. During treatment, you will be asked to sit or lie down, and a thin needle will be inserted under the skin into your abdomen area, at least 2 inches from your navel, avoiding any moles, scars, bruises, or areas where the skin is tender, red, hard, or broken. This needle will be connected to the prepared syringe containing OCREVUS ZUNOVO. Your healthcare provider will gently pinch a wide area of skin close to where you'll receive the injection, and then inject the needle. They may either inject the medicine themselves manually or use an automatic pump. If they are doing a manual administration, the line or tubing that the medication flows through will be secured with adhesive tape, and they will push the syringe plunger to start the injection. If a mechanical or electronic pump is being used to push the medicine, the syringe will be placed into that. During your injection, you will be observed for any injection reactions or adverse events. If you experience one, your treatment will be stopped, and your healthcare team will assess whether to continue treatment or provide supportive care. When the injection is finished, the infusion line will be removed and a small bandage will be placed over the injection site. A cold compress or other medications may also be used to help relieve injection site reactions. Post-treatment observation is at least 60 minutes for the first injection and at least 15 minutes for all injections after that. This lets your healthcare team watch out for any side effects related to your treatment. In a study of OCREVUS ZUNOVO, injection reactions were more commonly reported after the first treatment. Injection reactions can happen during or within 24 hours of your injection, and in clinical trials, most were mild to moderate. Injection reactions can be local or occur throughout the body, with common local symptoms including redness, pain, swelling, and itchiness. Other general symptoms that may happen throughout the body include headache and nausea. It's important that you call your healthcare provider right away if you see any signs or symptoms listed here. During clinical trials, all patients recovered from these reactions. Most injection reactions resolved within 3 days. These are not the only side effects. Please read the ISI for additional important safety information. Your healthcare team will observe you for 1 hour after your first injection. Every injection after that, you'll be observed for at least 15 minutes. Before you leave, make sure to schedule your next appointment for 6 months later. Talk to your doctor to see if 10-minute, 2 times a year, OCREVUS ZUNOVO is right for you.
What is OCREVUS ZUNOVO? OCREVUS ZUNOVO is a prescription medicine used to treat relapsing forms of multiple sclerosis, MS, to include clinically isolated syndrome, relapsing-remitting disease, and active secondary progressive disease in adults, primary progressive MS in adults. It is not known if OCREVUS ZUNOVO is safe and effective in children. Who should not receive OCREVUS ZUNOVO? Do not receive OCREVUS ZUNOVO if you have an active hepatitis B virus HBV infection, have had a life-threatening administration reaction to ocrelizumab, have had a life-threatening allergic reaction to ocrelizumab, hyaluronidase, or any of the ingredients of OCREVUS ZUNOVO. Tell your healthcare provider if you have had an allergic reaction to OCREVUS ZUNOVO or any of its ingredients in the past. What is the most important information I should know about OCREVUS ZUNOVO? OCREVUS ZUNOVO can cause serious side effects, including injection reactions. Injection reactions are a common side effect of OCREVUS ZUNOVO, which can be serious and may require you to be hospitalized. You will be monitored for signs and symptoms of an injection reaction when you receive OCREVUS ZUNOVO. This will happen during all injections for at least 1 hour after your first injection and for at least 15 minutes after all injections following the first injection. Tell your healthcare provider or nurse if you get any of these symptoms: itchy skin, rash, hives, tiredness, coughing or wheezing, trouble breathing, throat irritation or pain, feeling faint, fever, redness on your face, flushing, nausea, headache, swelling of the throat, dizziness, injection site pain, swelling or redness, shortness of breath, fatigue, fast heartbeat. These injection reactions can happen during or up to 24 hours after your injection. It is important that you call your healthcare provider right away if you get any of the signs or symptoms listed above after each injection. Infection. Infections are a common side effect. OCREVUS ZUNOVO increases your risk of getting upper respiratory tract infections, lower respiratory tract infections, skin infections, and herpes infections. Serious infections can happen with OCREVUS ZUNOVO, which can be life-threatening or cause death. Tell your healthcare provider if you have an infection or have any of the following signs of infection, including fever, chills, a cough that does not go away, or painful urination. Signs of herpes infection include cold sores, shingles, genital sores, skin rash, pain, and itching. Signs of more serious herpes infection include changes in vision, eye redness or eye pain, severe or persistent headache, stiff neck, and confusion. Signs of infection can happen during treatment or after you have received your last dose of OCREVUS ZUNOVO. Tell your healthcare provider right away if you have an infection. Your healthcare provider should delay your treatment with OCREVUS ZUNOVO until your infection is gone. Hepatitis B virus, HBV reactivation. Before starting treatment with ocrelizumab, your healthcare provider will do blood tests to check for hepatitis B viral infection. If you have ever had hepatitis B virus infection, the hepatitis B virus may become active again during or after treatment with OCREVUS ZUNOVO. Hepatitis B virus becoming active again, called reactivation, may cause serious liver problems, including liver failure or death. Your healthcare provider will monitor you if you are at risk for hepatitis B virus reactivation during treatment and after you stop receiving OCREVUS ZUNOVO. Weakened immune system. OCREVUS ZUNOVO taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Progressive multifocal leukoencephalopathy, PML. PML is a rare brain infection that usually leads to death or severe disability and has been reported with ocrelizumab. Symptoms of PML get worse over days to weeks. It is important that you call your healthcare provider right away if you have any new or worsening neurologic signs or symptoms that have lasted several days, including problems with thinking, eyesight, strength, balance, weakness on one side of your body, using your arms or legs, decreased immunoglobulins. OCREVUS ZUNOVO may cause a decrease in some types of antibodies. Your healthcare provider will do blood tests to check your blood immunoglobulin levels. Before receiving OCREVUS ZUNOVO, tell your healthcare provider about all of your medical conditions, including if you have or think you have an infection. See, what is the most important information I should know about OCREVUS ZUNOVO? Have ever taken, take, or plan to take medicines that affect your immune system or other treatments for MS. These medicines could increase your risk of getting an infection. Have ever had hepatitis B or are a carrier of the hepatitis B virus. Have a history of inflammatory bowel disease or colitis. Have a history of liver problems. Have had a recent vaccination or are scheduled to receive any vaccinations. You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with OCREVUS ZUNOVO. You should not receive live or live attenuated vaccines while you are being treated with OCREVUS ZUNOVO and until your healthcare provider tells you that your immune system is no longer weakened. When possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with OCREVUS ZUNOVO. If you would like to receive any non-live inactivated vaccines, including the seasonal flu vaccine, while you are being treated with OCREVUS ZUNOVO, talk to your healthcare provider. If you have a baby and you received OCREVUS ZUNOVO during your pregnancy, it is important to tell your baby's healthcare provider about receiving OCREVUS ZUNOVO so they can decide when your baby should be vaccinated. Are pregnant, think that you may be pregnant, or plan to become pregnant. It is not known if OCREVUS ZUNOVO will harm your unborn baby. You should use birth control, contraception during treatment with OCREVUS ZUNOVO and for 6 months after your last injection of OCREVUS ZUNOVO. Talk with your healthcare provider about which birth control method is right for you during this time. Tell your healthcare provider if you become pregnant while receiving OCREVUS ZUNOVO. Are breastfeeding or plan to breastfeed. It is not known if OCREVUS ZUNOVO passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take OCREVUS ZUNOVO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of OCREVUS ZUNOVO? OCREVUS ZUNOVO may cause serious side effects, including risk of cancers, malignancies, including breast cancer. Follow your healthcare provider's instructions about standard screening guidelines for breast cancer, inflammation of the colon, or colitis. Tell your healthcare provider if you have any symptoms of colitis, such as diarrhea, loose stools, or more frequent bowel movements than usual, stools that are black, tarry, sticky, or have blood or mucus, severe stomach area, abdomen, pain, or tenderness. Liver damage. OCREVUS ZUNOVO may cause liver damage. Your healthcare provider will do blood tests to check your liver before you start OCREVUS ZUNOVO and while you take OCREVUS ZUNOVO if needed. Tell your healthcare provider right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. The most common side effects of OCREVUS ZUNOVO include injection reactions, respiratory tract infections, skin infections. These are not all the possible side effects of OCREVUS ZUNOVO. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Genentech at 888-835-2555. For more information, go to www.ocrevus.com or call 1-844-627-3887. For additional safety information, please see the full prescribing information and medication guide.